Hello, everybody. This is Ronnie Smith, the Acting Director here at the Ralph H. Charleston VAMC Medical Center. I wanted to do this real quick video segment to you to let you know what's going on right now in dealing with our COVID response. I know there's a lot of actions going on around our organization, and it's hard to keep up. And so we thought it'd be more effective if we could do a quick video every once in a while to give you a quick update of what's going on. So the first, a couple of quick changes we've made recently. As of today, we went to a no visitor policy here at the medical center and our CVOCs. There are some exceptions to that, but in order to be safe for our patients and our staff and limit our traffic and potential exposure, our social distancing expectations, we have moved to a no visitor policy. This has been done in conjunction with all the other medical centers around us in partnership. And so we want to make sure we're doing as safe as possible. Our transportation services, our escort team, and our frontline screening staff are going to be working with our veterans as they come in, and if they bring somebody with them, along with our police will be assisting those veterans. But we're going to do everything we can to limit traffic here. Screening at the door, we've had employee screenings and veteran screenings going on now for a short time now. As soon as we get some more thermometers in, we will be going to temperature checks. Right now, we're asking all employees to self-check before and after work. If you have a fever or feeling ill, that you notify your supervisor immediately so they can work with you. We want you to be here at work. But we also want to make sure you're safe here as well. High-risk employees, we've asked all supervisors and sent out notification for those that are 65 or older, pregnant women, those that have a chronic medical condition, immunocompromised, work with your supervisor and employee health about your particular situation. We want to make sure you're safe. But these individuals are going to be more susceptible to the COVID disease, and so we want to make sure we can do what we can to protect you, while also making sure you can help us continue to be able to serve our patients during this emergent need. PPE conservation. This is the biggest issue I know everyone's been thinking about and talking about when we go around to talk to staff here at the medical center. Is a major concern and worry. I just want to assure you we do have PPE available for critical needs and when it is needed. But we've been seeing a situation where PPE has been used when it's not really necessary. We want to make sure everybody's following the science that is available out there about this. There's good guidelines available. Their infection control team is here to assist everyone that has questions. And we have great guidance from the CDC and other hospitals that have been dealing with the situation much more than we have at this point. But we also want to make sure when the time comes that we start seeing COVID patients in our hospital, we've got what we need. So right now we're doing everything we can to conserve PPE, knowing that we're expecting a higher volume of patients here in the near future that will be COVID positive, and we got to be ready to manage that situation. We are getting shipments. It's sometimes a little slower than we would like due to the sheer volume of all the other hospitals requesting PPE as well. But we've got a lot of things our logistics team and others are leveraging to get us additional PPE and make sure we have what we need when we need it. And another thing is this situation with COVID generates a lot of anxiety. I know there's a lot of concerns out there. Everyone's feeling the pressure and anxiety of dealing with their home life and everything that's going on here at the medical center. Things are changing very rapidly, but we also know the situation is probably going to be going on for a long time. So I've asked a group of leaders here in the medical center, including employee health, education, our HRO, chaplain service, mental health, to get together and start being able to come up with ways that we can support our staff for employee wellness and mindfulness while we get through this. We want to be here to support you all so we can continue to support our veterans as well. But we will be hearing more from us in the very near future. They're going to be giving some tips on what we can all be doing to keep ourselves safe and fresh while we get through this over the next several months. That's all for today. Make sure you're staying socially distanced as much as possible. Make sure you wash your hands with soap and water for at least 20 seconds on a regular basis, and we'll talk to you soon. Thanks.